All right, everybody, welcome this evening to the Free Market Cash Patient webinar. I'm your host, Jeff Cantor, along with my co-host, Charles Frohman. As you can see here, we're offering you the chance to subscribe to these if you're not already, or if you'd like to invite others, there's a site to go to. And when you get there, I'll show you what you see. Also, the fact that we're sponsored by your Freedom Hub. So that being the case, let me show you a quick diversion here. So if you go and want to subscribe, you'll land at this page, and this is where you can go ahead and subscribe away. And then the videos are in a variety of places, and I'll show the links at the end, but we're up on BitChute, Brighteon, and on YouTube. So we got videos all over the place. So on that note, we're going to spring into this evening's festivities where we have a really interesting guest, which is a part of the free market healthcare package that's going on out there. So Charles, I'm going to give you the floor here and do an introduction.
Sure, Jeff, and thanks and welcome, David. David Shull is Director of Business Development and Broker Relations at Apex Management Group, which specializes in minimal essential coverage MEC arrangements for employers of all size. And for the company that we promote through our hub and a new award-winning WOW app, utilizes his MEC in such a way that it allows for tax-favored health savings accounts. So we're excited to hear that specifically and about his market in general.
Thank you very much, Jeff and Charles. I really appreciate the opportunity to speak to your audience this evening. We're very excited actually about the partnerships that we've been able to develop across the country. A lot of our brokers, partners, and associations we work with kind of know us as a benefit solutions vendor. And one of the products that actually is the most common in the Apex suite of products is this high deductible basic MEC plan, which is very unique in the industry because it makes it HSA compatible. And we'll talk a little bit more about that in detail as we go through the slides. Next, Jeff. My name again is David Shull. I am Director of Business Development and Broker Relations at Apex Management Group. My contact information is here, and it's going to show up again on the last slide. So please feel free to reach out and contact me if you have any questions on our presentations. Quite frankly, it would be my pleasure to assist in any capacity whatsoever. We all know why we're here. This is kind of a little bit of a redundant slide, but we all know what's happened to premium increases over the last many, many years. And it's really created what we refer to as an unsustainable squeeze. And that's between whether it's an employer, whether it's an employee, whether it's a 1099 individual right now. The idea of trying to find an affordable healthcare solution is really being done by those people that are out there today that are really creative. And so that's, again, why we're really excited about our partnership that we have here this evening. Next. As your solutions partner, one of the things that we work with in regards to whether it's a broker, whether it's association, business, or individuals, our real focus is on packaging and putting together, affordable healthcare solutions. And it's a partnership that marries our plans with Sedera Health, medical cost sharing, and many, many other options. And another unique feature that we'll talk about in regards to our plans is that when you enroll in our plans, one of our suite of MEC plans, we have a 4-year rate lock on those plans that I'm aware of. Nobody in the industry, aside from us at Apex Management Groups, offer these types of plans with a 4-year rate lock. So it's the ability to provide some rate stability in a very, very unstable market. And so if we look at this, the plan that we're going to be talking about tonight is really a 2-part program. There's a high deductible health portion of the plan, which allows the HSA compatibility. And we're also going to be talking about the basic MEC. The two packaged together create the dynamics to allow for that HSA compatibility, and yet at the same time cover all of your preventive care services that are mandated by the Affordable Care Act with no co-insurance, no co-pays, no whatsoever. So in reference to the high deductible health plan, that portion of our plan, it provides that framework again that allows HSA compatibility. It has an individual deductible of $3,000. and a family deductible of $6,000 per family. After you meet that deductible, it's 80/20 coinsurance, and it has a maximum out of pocket of $6,900 an individual and $13,800 for family. Now, this may be construed as a little differently by some members, but that what we just discussed provides the framework to make it an HSA eligible plan. With that being said, it does not contain everything that you would look at in a conventional, fully insured, high deductible health plan. So we have to frame this for the purpose of our presentation. It's just providing the framework to allow that HSA compatibility. There's only 3 services that are actually covered under this $3,000 deductible, and that's primary care, urgent care, and laboratory services. Those are the only 3 items that track towards that deductible. So it's a very limited in regards to its scope, but typically this high deductible basic health plan is going to be paired with an HSA as well as a medical cost sharing program, which does address those catastrophic and those unforeseen expenses. Next. And again, since the plan is HSA compatible, you can pair this up with any type of HSA program, which I'm going to allow Jeff and Charles to talk a little bit about. But as far as the HSA contain what we refer to as a triple tax advantage. Any contribution that you and or your members put into the HSA are 100% deductible to them. Withdrawals for any qualified expenses are tax-free. The interest that's actually grown on the account is tax deferred, and then any of the unused funds roll over from year to year. We have many members that are actually putting money away into that HSA, not to necessarily use it for some of the covered medical expenses, but to use it to set it aside to have it for medical expenses as they grow older in years. But it can be used in any of those ways. The funds can be used for any type of dental, vision, prescription drugs, doctor's office visits, deductibles, copays, and whatever out-of-pocket costs might be. The contribution limits for 2020 are $3,550 for individuals, $7,100 for those that are enrolled in a family plan, and for individuals that are over the age of 55, they can contribute an additional $1,000 in an annual contribution to that HSA. So once you get to be my age or higher, we're putting as much as $4,550 away, each year for my medical expenses. And the majority of the time, I get to roll the majority of that over, and I hope that you would as well. Next. In addition to that framework to make this plan HSA compatible, it's going to cover 100% of the ACA mandated preventive care services. So for adults that are age 18 and over, that's actually 21 preventive care services, including things like blood and cholesterol screening, colorectal cancer screening, or colonoscopy, and immunizations and vaccines. For women, there's actually 28 preventive care services, with the biggest item there being mammography in women over the age of 40. It also picks up things like diabetes screening and pap smear, but anything that's covered or anything that's mandated by the Affordable Care Act is going to be covered 100%, again, without any copays or coinsurance. For children, the biggest item there is actually the immunization vaccine. All vaccines that are required to be covered under children are going to be covered actually 100%. But it also picks up things like obesity screening, counseling, and autism screening. But there's a total of over 80 preventive care services that are covered in that nature by the MEC portion of the plan, and they're covered 100%. No coinsurance, no copays. Next. One of the things that we'd like to make sure of is, our plan is actually driven by a physician network. The physician network that we utilize is PHCS. And it's important to note that there is no coverage for out-of-network services. So how do you actually make sure that before I go get my services, that I'm actually going to be going to a participating PHCS physician? So the first thing you would do, it would be go to multiplan.com. You would click on Find a Provider, which is going to appear on the top right-hand side. And then on the bottom, you would click OK at the bottom right-hand corner. And that's going to take you into a section that you actually select your network. This is actually very, very important because MultiPlan has several networks. So you'd have to select PHCS. You know, when you click that PHCS, and that's going to take you to the next step. Advance it. And so from that, you're going to actually be choosing a drop-down services from a menu. You would click Preventive Services Only. And once you click on Preventive Services Only, just to actually start your provider search, you're going to need to actually enter into the box what type of physician you are searching for. Is it primary care? Is it a pediatrician for my children? Is it a gynecologist, etc.? But it's very important that you're going to have to enter, you know, what type of practice that you are looking for. From there, you would actually go to step number 8, and it's going to ask you to enter a zip code. Once you enter that zip code, you're going to click on OK. And after you click on OK, and actually a directory is going to be generated that you can then print in a PDF version. But that's going to give you in most cases, well over 200 physicians in a geographical area that you can choose from. You can expand that search even beyond that if you want. But it's very easy to just click that printer-friendly version, save it to a PDF, and then you're going to have it to refer to as you go forward. Thank you. And one of the things that we like to make sure of, and there has been some confusion about this high deductible health plan. And one of the things that, you know, that we look at, you know, our high deductible health portion of our plan is $66 a month for individual premium and $96 a month actually for 2 or more. That would be parent and child, husband and wife, and or full family coverages. So for $66 a month, obviously we are not delivering a conventional fully insured marketplace plan because our plan does not provide catastrophic coverage and it does not provide unlimited care. It is strictly structured to provide the framework to make it an HSA eligible plan and also provide those preventive care services that the Affordable Care Act mandates. And one of the things that we like to make sure of, and which our partners do tonight, that if we look at, you know, our plan, which is going to address preventive care, is going to allow the compatibility to establish an HSA, but it's very, very important that from that step, that's 2 of the components that you should have in place. The third component, which we're not going to get into detail tonight, but that third component is really designed to address those catastrophic, unforeseen medical expenses. So the Apex plan, you should actually be paired with Sedera Health, a medical cost sharing plan that's offered in conjunction with Health Excellence Plus. Next. And there's items that we'd like to note. You know, we get things that come up quite often. Somebody will enroll in the plan, and they'll enroll on the 15th, 17th, or 18th of the month. And the files don't necessarily go over at that time. So we like to make sure that after you're enrolling, before you start scheduling any kind of preventive care, especially things that need to be scheduled, at least allow a few days after your effective date for your card to arrive. So don't schedule those appointments right on the 1st or the 2nd, because when you do that, you may not have your card in hand. When you go to the doctor, you know, first of all, you want to determine in advance if they are participating. So you would follow the instructions that we just gave you earlier and go to multiplan.com and follow those steps. Or you can also call 800-922-4362. That's the direct number for PHCS. And you can also validate with them live on the phone if the physician that you intend to see is actually in network. And that is a very, very important first step to take to make sure that your provider that you are visiting is a participating provider with PHCS. At the time that you're actually at your physician's appointment, always present your ID card. You know, we hear a lot of times something comes back from a member where they got a bill that came directly to them. And most of the times, actually probably 99 out of 100, it's like that they received that bill because they did not present their ID card at the time of service. But the ID card, this is an image of the front and back of your card, gives the provider everything that they're going to need to file a claim. You know, so it's going to give them the address where they send it. It's got the 800 number there. But all the information that you and or a member are going to need is actually going to be on that ID card to file any claims. In addition to that, if you have any questions on claims, or you may have misplaced your ID card, there's actually a customer service number for you to call. And that customer service number is 866-826-5317. So instead of actually reaching out to an advisor or whatever, you can actually call the vendor, call our third-party administrator direct, and they'd be happy to assist you with any kind of claims, questions on EOBs, questions on your ID cards, or the plan itself. Please feel free to give them a call. And there are several members on our staff of our TPA, which is a wide mainland administrators, that are fully dedicated to be there to assist you on any questions and claims that you might have. And the other TPA basically that we work with, another one is Regional Care Incorporated. The same thing applies there, and I'll make sure that I give a copy of that card and that claim as well. Next. So again, here's my information. Again, I'm David Shull. I'm the Director of Business Development and Broker Relations with Apex Management Group. I can be reached at 814-737-9052. And you have my email address at bshull@apexmanagementgroup.com. And we can actually leave that up for a couple minutes while we actually open it up to any kind of Q&A that anybody may have.
Okay, very good. Thanks so much there, Dave. David, I know you got your hand up there.
Thank you, Jeff. David, I assume there is a shared age limit that you share with Health Excellence Plus. And the other question is, how do you handle pre-existing conditions?
In regards to the HSA, there obviously there's not going to be any, it's going to be any admin expenses that are incurred. In regards to our preventive care plan, there is no pre-existing condition. The only place that a pre-existing condition limitation is going to fall on is with Sedera Health and the medical cost sharing platform.
Okay, and the age limit?
We cover up to the age of 65.
Same as Health Excellence Plus. We terminate at the age of 65 as well. Because at that point, ideally, the person's moved over to Medicare.
Also had a question about employers of different sizes, whether they enroll their workers as individuals in a list bill or a true group plan, if you want to kind of mention.
For individuals, the challenge for most people in the individual market, most people get their health insurance from work. But there's a large measure of people that don't, and those are the ones we always hear about in the news, because that's the ones that are getting killed. The ones at work are getting killed in their own way, but at least they've got the coverage. So, but the consumer a lot of times just has to forego it because they're making a lot of money as it would appear on paper, but by the time you back out their expenses and the kids and everything else, they're not really that rich after all. And then they go on the market and the price of the stuff is bigger than their mortgage. So they'll just forget it or get the crummiest thing that they can find. So with us, because we're able to give them a superior plan, but also to cut the price, typically better than in half, now they can afford to get something that they really like. I mean, at first blush, their goal is to save money. And then once they've gotten it, they realize, how good this is and what it does for them. If you're a small business owner, typically can't do any health insurance because the cost is ridiculous. One of the statistics that the WOW people like to quote is that Starbucks spends more on its health insurance than it does on coffee beans. So something's wrong with that picture type of a thing. So a small business owner just making the little widgets, they can't afford to cover everybody in the place for health insurance. And so they just typically say you're on your own. Now we give them the ability to have something that's reasonably priced. So they either can try to pay full boat for it themselves and, take care of all the employees, or put a portion of money. I'm going to give you a couple hundred bucks a month towards this thing. And maybe it's $300 a month. So you only have to pay $100 type of thing. And this allows them to do it. It's what we call a list bill, where they can literally just get one little statement a month. The employer just cuts a check, pulls it out of the employee's paycheck, or however that's being handled, and it's a done deal. The other option is to become a true group, and not everybody understands that. But if you're a company and you want to have a quote-unquote group policy, there's administrative involvement. They have an HR department, and they're really involved in the whole process. And there's multiple checks to cut. typically, and a lot of other moving parts. So a lot of businesses don't want to bother. So they'll try to ride that list bill as far as they can.
But for the tiniest employers, 20 or less or so, you could have a group plan for your employees without the group overhead headache. I think that's what you're saying.
Yes, definitely. So, but on that note, CJ, I wanted to let you get a question in here.
Oh, thank you. And David, it's wonderful to see and hear your presentation. We actually, you and I met with Jeff Cantor and Charles Foreman there in Florida a year and a half ago. I was very impressed at that time at what Apex has done and how large you've got. And this is not supposed to be a layup question, but a serious question. When someone sees an opportunity like this, how should we evaluate the financial wherewithal that's so important? I know you've got that covered with Apex, but I'd like to hear about it, that to make sure you're going to be there when we need you.
Well, Apex has, since our inception, we've grown to have to date overall about 44,000 subscribers. That doesn't count the belly buttons independents, but that's about 44,000 subscribers. At the start of the gate, when we launched, Apex Management Group, which now goes back a little over 6 years ago, in that entire period of time, I would probably say without question, we are the only MEC solution available in the country today that has never gone back to a client and requested more cash. When we set up a MEC plan, we set it up, although it's not fully insured, we set that up to function and look and smell just like it is an insured product, when the reality of it is a self-funded plan. So, our members, our brokers, and our partners know the idea that when they look at our premiums, under any circumstances, will they ever get billed more than what we are showing? So that stability that employers and a lot of I know our clients that are currently with us came to us only because of that one fact and that one fact alone. As an example, when you have somebody that just launches the plan and it's a small employer group and maybe they have 6 people, and 2 of them go out immediately and have colonoscopies because they didn't have preventive care before. So in almost all of the plans out there, that the employer is going to be presented a cash call for any of the claims that exceeded what's been funded with that first month's premium, those first month contributions. So we give our clients and our broker partners that assurance that will never happen. So there's that financial security is there.
Boy, that's great. And David, you've been with them how long?
I've been affiliated with them indirectly for the entire 6 years, but on a direct basis for about 3 now.
Boy, well, congratulations and thank you.
And I'll tell you that, and that you can't emphasize that enough, Dave, because I've heard that horror story many a time that they get this self-funded group, and just like you said, all these people that have been putting off whatever suddenly have this. They go run right out, and the employer is totally startled to discover, you only raised $1,000, but these colonoscopies were $13,000. So where's your $12,000?
Exactly. And it becomes easier to do that too as the spread of the risk happens and as volume continues to grow. But, we've stayed true to that course ever since our inception.
It's an excellent element. And again, that's why we're using this entity this way for sure, as you can see. The idea is to make the consumer economically better off and bulletproof when it comes to whatever might start to crop up, and have thought of all the key things that they didn't foresee. They figured, what if I have a heart attack? I better be ready for that. But that was only like a small element of all the rest of what's potentially going to happen. And that's what we wanted to make sure we figured all those elements in there to really help them out. Charles, did I see your hand pop up again?
Yes, Jeff. I would like to invite a couple guests to speak if they're brave enough and want to unmute themselves. One is, Paul Roberts, a new member of Health Excellence Plus, to see if he's had an occasion to look into the MEC for the preventive services yet.
Yeah, I'll chime in. This is Paul. I've had an opportunity certainly to look into the MEC, program. I think it's great. There's a lot of great, opportunity and integration there.
So Paul, real quick, just you're making a comment, but not everybody appreciates kind of your perspective or why you're there. What have you been up to of late? Why don't you tell everybody what you're about to do?
Oh, well, yeah, so I'm making a documentary, and it's a healthcare reform documentary. And we're in post-production right now. It's due to be released in the spring, in April. And part of the documentary focuses on the free healthcare sector, so free market healthcare. Yeah, certainly looking forward to getting it out there. And I think, the movie hopefully will promote the free market healthcare options out there. Jeff and Charles are both in the documentary, and Dr. Levine as well. And yeah, it's very good. Looking forward to getting it out there.
I definitely was excited about being a participant in it. It was interesting to see all the different people that came, before and after me, and I've seen some of the other clips and stuff that you did, interviews over the time, well before I was involved. And so it's going to definitely help. It can't. I mean, there's so many great voices and stories in just the little trailers you've created, and the more that this, light gets shined on what's going on here, the more even everyone else has started to realize that, healthcare in America is pretty awesome. It's just how we're paying for it that's all messed up. There's really nothing wrong with the system, because some of the excesses will resolve themselves when the market comes to bear. We won't have frivolous tests as often, and all those things will sort of self-resolve. But it's just lending itself to nothing but excesses and abuse. We have a doctor we know, and he found out one of his colleagues was cheating Medicare by taking a fake photograph, every so many photographs of people he was working on, and they couldn't figure it out, so they just paid the guy anyway. So he called up to complain and say, this guy's taking advantage. And they said, well, but based on what you're telling us, he's not taking enough of an advantage for us to bother, because it would cost more to fiddle around with that person than to stop them from abusing the system. So they just allow a lot of waste just by default, because it's just the stuff they realize. It's like a store that realizes they're going to lose just so many tubes of toothpaste get stolen a month. They just build it into the rest of their prices. But in this world, you don't have to, because it's me talking to that doc. They said they want $150, and guess what? That's what they get. So there's zero waste. So yeah, it's going to be great that you pointed out, Paul.
Yeah, and Jeff too. I would just add to that too, that part of the documentary is also about the ways that we can lower the cost of healthcare, and really this can apply to the free market sector as well, with case management, for example. Yeah, that's kind of where my background is in case management, and I'm hoping to integrate that into the free market system to lower the cost, even of the cost sharing programs, so that we can drive down the cost further.
Oh, that's an obvious solution. I mean, it's sort of happened in the idea where we have that second MD built in. So when someone's told they need back surgery, some unbiased experts very inexpensively can review it to make sure if that's good. So that collaborative approach is fantastic. But yeah, there's no incentive for that to occur in the current world. None. In fact, they're very adversarial. I know, as a good example, a direct primary care physician doesn't like their doctor to end up in the hospital, because then it becomes the hospital's patient. And now they're fearful of losing the client and all the rest of that stuff. So it's not set up for it to be beneficial for anybody's set of circumstances, especially the patient. So that was good. Let's see, who else have I got any questions from here? Charles, did I see you again here? I thought I had your...
Well, I mean, we do have some nice guests here, and CJ asked a question if we had time to invite him to say a quick, 1-minute update on his consolidation of our medical records in his vaults, which every Health Excellence Plus member gets. Maybe a quick update from CJ would be nice.
I would agree.
Gentlemen, thank you. And again, our goal really is to continue to work with these phenomenal firms like Apex and Sedera, and our oldest client, my Excellence Plus here. So this is a long-term relationship, and you guys have really defined what we provide, which is a very simple emergency profile, which Apple phones and other people provide. But what we've done is feel that when you do avail yourself of services like David's offering, it helps if you've got your medical records with you. So we help you pull those medical records from over 4,000 hospitals. You have a chance to look for errors, which do exist about 40% of the time, to update them with your notes, and then ideally start to track your health a little bit better. And it's private. We never sell the data. You pull it from whatever sources you have in a multitude of ways. And with the encouragement now of Health Excellence Plus, we're making it even more user-friendly. So that's our product roadmap. But we think that fundamental need for someone to help you get your records is a baseline. But David, again, I hope we have a chance to continue that conversation that we started in Florida, though, also.
Thank you. We're looking forward to picking it back up.
Fantastic. Well, unfortunately, we're reaching the conclusion of our time slot for today. So, David, I definitely want to thank you for spending some time and getting some of that good outside input, too. But it was very good and very helpful and very educational, of course, gives everyone a better understanding of all this. Sometimes part of what you're talking about is oftentimes gets glossed over. It's like, oh, and by the way, and then right away they want to know about all the other stuff. But it's as important as everything else. So it's good to take a breather here and catch up on it. So again,
all components given. We all have our very important place in this process.
That's it. I mean, it's, like I told you, if you have a car, you got to have a mechanic and you got somebody to get the tires from. And, it's not just like one thing. You need a whole team, and the same when it comes to your health, and you're another integral part of that team. So again, thanks. So also for those, my pleasure. Again, here's the site for you to be able to subscribe. We have our various locations on BitChute, Brighteon, and YouTube, where these will be published. They are usually completed and posted on the weekend, so they will be up and running by next week. And we look forward to seeing you the next go around. So thanks, everyone.
Thank you, and have a wonderful evening. Bye.